Well, so one of the things that helps us identify whether mold is a problem, aside from a failed grain-free diet or gluten-free diet, is different types of tests. You know, I live by a credo within my practice, which is test, don't guess, because so many doctors guess, or so many doctors will gaslight you, right? You'll go in. It's crazy how much I see this. A patient goes into the doctor's office, they list out this plethora of different symptoms and problems that they're having. The doctor can't figure it out. So in essence, instead of diving deep and doing some testing and actually believing their patients, they gaslight them. They say, oh, it's in your head, you're just stressed out. And they send them off to the psychiatrist for some antidepressants. Or blame everything on depression, or blame everything on stress. And this is very, very common, especially in the mold world, because if you're in mold, you are chronically sick, and no matter what you do, no matter how you try to supplement, no matter how you change your diet, no matter how you try to exercise or do the right things, you just can't make a recovery. So there's some specific types of tests that can be done to help you to determine whether or not you have a mold issue. And so let's talk about some testing for you, right, for yourself. And one of these tests is to look at mycotoxin levels. Now, what is a mycotoxin? Mold produces these chemicals, if you will, these volatile organic compounds. They're byproducts of mold, and they're called mycotoxins. And there are different types of mycotoxins. There are toxins that are produced by different strains or different species of mold. So, for example, we've got black mold produces a type or a family of mold toxins called trichothecenes. Then we also have aspergillus and penicillium molds that produce things like ochratoxin and aflatoxin. There are a number of different families of mold toxins, and these can be tested for. Now, this type of testing medically is relatively new. It's about as new as 20 years old, meaning it hasn't been around for a super long period of time. So a lot of doctors aren't aware. They're just not aware of how to do it. They're not aware that it can be done, right? And this is one of the most critical, the most important tests if you suspect mold. And the reason why, if you have mycotoxins in your body, and it can be measured being excreted from your body, then we actually can confirm beyond the shadow of a doubt that you do have mold exposure. Now, whether that mold exposure is coming from your house or whether that mold exposure is coming from foods, because certain foods can also contain mycotoxins as well. As a matter of fact, in farming, the industry itself, mycotoxicosis in animals is a common problem, and there are a lot of nutritional technologies that are implemented in farming to try to remove mycotoxins from foods. But you can eat mycotoxins in moldy types of foods. You can also be exposed to a water-damaged building, and it doesn't even necessarily have to have been water damage. It could be improper construction. There are a number of things that happen during construction that can lead to a breach of the moisture barriers or the vapor barriers around your home, and that can lead to mold growth as well. So mycotoxin testing tells you beyond the shadow of a doubt that you're being exposed to mold in high enough quantities to register high levels of toxins coming out of you. So this is, in my opinion, one of the most important tests to ask your doctor to measure. Then we also have tests that can measure yeast overgrowth. Now, let's talk about the difference between mold and mold toxins versus a yeast overgrowth. Whereas yeast overgrowth is when the mold grows in you, inside of you. The common example of this is Candida. If you ever heard of Candida, the Candida is a type of yeast or mold. Candida albicans, one of the most common discussed. I've discussed it a number of times in its relationship to gluten, because this particular species of mold has been shown to mimic, to make proteins that mimic gluten. And so we know that people with chronic candidiasis or Candida overgrowth act very, very similarly to somebody who's getting gluten exposure when they're gluten sensitive. So we know Candida can grow in you, and this can be measured as well. How do you measure it? You can measure it by looking at your microbiome. There are specific types of technologies that can measure microbiome, and you can also measure Candida antibodies. There are a number of different antibody tests that you can have your doctor measure that can help you understand whether or not you have Candida happening in you as well. So yeast overgrowth, again, most typically occurs in the mouth, in the GI tract, and ladies in the vaginal canal. Those are the three primary areas where we'll see yeast overgrowth. Sometimes we'll see it further up. So mouth, I said, and GI tract including the esophagus. As a matter of fact, candidiasis is a very, very common cause of esophageal inflammation. So if you've had a scope done and the docs are saying, yeah, you've got some inflammation in your esophagus and in your stomach, we don't know why, there's no discernible reason, think Candida or candidiasis and ask for antibody testing, because that might be the thing that helps you understand it. Now, yeast overgrowth in your body is not the same thing as mold growing in your home. They're different types of mold, and they're different types of problems altogether. But I just want you to understand, yeast overgrowth in the body oftentimes occurs as a result of mycotoxicosis or mycotoxin exposure, meaning that when mycotoxins, when you're exposed to heavy quantities of them, one of the side effects is immune suppression. And when you have immune suppression, what happens is mold is opportunist, right? Candida is an opportunist. We all have some degrees of mold in us, Candida inside of us, but when we have immunosuppression, that Candida, that small amount, can grow out of control and become a very, very large amount. And so again, we call it an opportunist. And when that immune system is suppressed, we have the opportunity for mold to begin growing more aggressively inside of us. And this is very, very common to see this happen. Now, we'll also see yeast overgrowth happening on the skin. It can manifest as eczema. We'll see yeast overgrowth in the nail beds, yellow discoloration under the nail beds, whether it be the fingers or the toes. Those are opportunistic infections caused by immune suppression, because healthy immune systems generally fight mold from overgrowing. But yeast overgrowth is a symptom of the potential for environmental mold exposure causing immune suppression in you. And then there's also testing that can be done for mold allergies. And that brings me to a point I want to address, because again, what you'll hear a lot, I get this all the time from immunologists and allergists. So if you go see a doctor and they're an immunologist / allergist, a lot of times they'll do a skin prick test for molds, and they'll tell you, here's some Benadryl, or here's some Zyrtec, or here's some Allegra, or whatever. Here's an immune suppressing medicine to stop you from having the symptoms of the immune response from the thing that you're allergic to. And they'll tell you that mold, beyond being allergic to mold is not typically a problem. And I get so sick of hearing this from the doctors that are supposed to be the experts in immunology, and oftentimes they're just not. That's not to say there aren't good ones out there, but I get this a lot, is that mold is only a problem if you're allergic to it. Okay, the same thing, it's the same scenario with gluten, right? Gluten is only a problem if you have celiac disease. And we know that's not true, right? Because celiac is just one of many manifestations of gluten-induced autoimmune inflammation. Well, it's the same thing with mold. An allergic reaction to mold is possible. So this, you can be allergic to mold. We'll put a check by that. But you can also have a overgrowth, as I was talking about earlier, an opportunistic overgrowth, or some doctors will call it infection. This can also be true, and this can also cause a list of symptoms and problems of its own. You can also be reacting to the mycotoxins directly. And that, again, that's why we can measure mycotoxins. That's why it's so important to measure them, because when you react to mycotoxins, the list of symptoms is quite long, and it's not the same as allergy. And as we'll talk about tonight, there are a number of different things that when you have this trifecta, right, when you're allergic to mold, but you also have an overgrowth of different types of fungus, and you also have external mold growing in your home, creating mycotoxins that you're inhaling, that you're absorbing through your skin and your mucous membranes. This trifecta is the most dangerous. Now, what I sometimes see is some people are just allergic to mold and they're not living in mold, but when they are exposed to higher quantities of mold, they struggle. Their immune system struggles. This is kind of the best case scenario, right? The overgrowth, or the yeast overgrowth candidiasis, that's not the best scenario, because these can be tough to deal with. These are oftentimes very challenging to get rid of. And then there's mycotoxicosis or mycotoxin levels. This is almost always, not always, but almost always environmental. That means either you're living in it or you're working in it. And so, or you're driving in it, because your car can be, your car could have mold growing in its air ducts and everything else. So living, working, or driving are common areas where we'll see people get the environmental exposure. Now, the other thing I commonly hear is that, look, everybody is exposed to mold. Mold is everywhere. Yes, mold is everywhere. I've heard that be said, and I'm sure you have if you have had that conversation with your doctor. Mold is everywhere. But when you concentrate mold into the box of your house, right, and you've got all those mycotoxins inside your home, it's a higher concentration gradient than it is if you were to have the same amount outside, because outside you've got trillions of tons of cubic airspace. In your home, you've got a finite closed area, and if you've got mold, auto-perpetuating mycotoxins on a regular basis, this concentrates and recirculates through your home and through your body. And so just because mold is everywhere outside doesn't mean that having mold in your house is this harmless thing. I get this a lot, even with mold inspectors. They'll come out and they'll do certain types of tests, and they'll try to tell you, you don't have much of a mold problem because they can't see it. Right, and that's another hallmark. That's another major issue. So again, coming back to mold can affect you in a way where you can be allergic to it, where you can be exposed or poisoned by the mycotoxins, but also where you have mold that can grow or overgrow inside of you. Now, if you're not sure whether this is coming from food or whether it's coming from potentially your home, there are a couple of different things that you should have done. And one is, you can do, this is a screening test. It's called an ERMI. And I say it's a screening test because it's not definitive. An ERMI, that stands for Environmental Relativity Mold Index. And this is a dust swab in the house where they do a PCR, a polymerase chain reaction, measuring quantities of mold spores per gram of dust that you collect. And so this can oftentimes be an indicator that you have a problem. So an ERMI is it's a lot less expensive to do an ERMI than it is to hire a mold inspector to come out. The ERMI test costs a couple $100. A mold inspector, you're starting in the realm of at least that amount. So a mold investigator. Now, my advice, if you suspect you've got mold in the home, the worst thing you could possibly do is hire a mold inspector who comes out, charges you $500, and they run an air test. They run 2 air tests usually, sometimes a little bit more, but they'll run an air test in your home, and then they'll also run an air test outside, and they call that the control. So they're comparing the quantity of mold in the house from an air test versus the quantity of mold circulating outside. So going back to what I said a minute ago, which it's all about the concentration gradient, you can measure the same amount of mold or mycotoxin floating around outside as you can in your house. That doesn't mean that living in your house is safe because it's the same amount outside. Remember, it's about the concentration gradient, the more you're getting exposed to in higher concentrations over time. So again, the worst thing you can do is hire an investigator to come out and do an air test. Like, if this is all they're doing, don't spend the money. It's a waste of time. Now, a lot of people struggle to find a good mold inspector, and so one of the things that I would encourage you all, if you suspect mold, is don't just open the yellow pages and try to find a mold inspector, or don't call your realtor and look for a mold inspector. The industry is just like the medical industry. It's full of people who are inadequate at their jobs, and they want to come out and do a quick test and make a quick buck, and they don't really care one way or the other oftentimes whether you do or don't have mold. They're in it for the volume of the money that they're producing. Now again, I don't want to demonize all mold investigators, but this is a very, very common trend that I've seen in 21 years of practice. So how do you find one that's good? You contact a mold litigation attorney. Why do you contact a mold litigation attorney? You get a referral from a mold litigation attorney. Not that you're taking anybody to court per se, but the thing with mold litigation attorneys They know the best mold inspectors, and here's why. They have to be very, very sure when they take a builder or they take a landlord to court in an attempt to prove that mold is poisoning their client. They have to have all the best evidence. They have to have the imaging, they have to have the PCR testing, the mycotoxin testing, the mold testing. So they don't rely on this air test or on that mold inspector who's just simply doing an air test. So call that mold litigation attorney and find out who is the person that you would recommend that I use as if I were preparing for a court battle, because that's the inspector that's going to come out and do a good job. Some of the tools that a good mold inspector will come out with, yes, they will have an air test, but they'll also have an infrared camera. They'll have a fiber optic camera they can run behind your walls. A good mold investigator might have a smoke machine where they can measure airflow through your walls to see whether or not you have vapor barrier problems from your attic where moisture and outdoor mold spores are bleeding through into your wall cavities, because that's a common way that mold can grow behind your walls where you don't see it. So air testing in that way, or smoke testing, airflow testing, it can be a very important tool. So you want to make sure that that mold inspector also has things like moisture readers and knows how to use them. Ideally, that mold inspector should get a thorough history of your home, meaning not just come over and say, oh, yeah, I'm going to run an air test real quick, but they should talk to you about any of the potential for pipe bursts or leaks or roof leaks or any history about your home that might indicate that there is a potential for mold to be growing, especially in a particular place. They also will do a very thorough evaluation of your HVAC system to make sure there's not mold growing inside of your AC ducts. This is a common thing that we'll see, people that turn on their AC ducts after the winter or turn on their heater at the beginning of winter, where all that air is stirring up and blowing and they've got mold growing in their ductwork. That really can cause a major exacerbation. So again, they should be doing all those things. They should be doing an investigation, not a test, not a simple test, but an investigation. Okay, and so don't spend the money if they're not going to do their job and do the right work. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.